all acknowledge that there's no quick fix to these problems. But we are seeing, I think, some really encouraging, innovative use cases of AI and really focus where we sit with Nuance around reducing the administrative burden on the healthcare teams, also improving that patient provider experience and trying to provide timelier access to critical patient information. Oftentimes, physicians will tell us, I know the data is all out there, but the time that it would take for me to access everything is just, it's very cumbersome, and it's not producing the experience that I want to give to my patients. Overall, I think that helps to restore the joy of practicing medicine again. And we can do things, if we can reduce this burden, we can actually reduce costs and improve the quality of care. I would say for clinicians, my experience has really been that trust is a huge component. And a lot of clinicians have been introduced to new technologies over the years that have really overpromised and unfortunately have underdelivered. They've hurt clinicians' trust when it comes to new technology. And this is really, I think, a core thing that we try to do at Nuance. We really aim to preserve the clinician trust in everything we do. We really focus in on their workflow. And is this going to be seamless? Is it going to work in the EHR, the electronic health record that they use, et cetera? I think ultimately the clinician, whether they use technology, how they use technology, they still ultimately feel the responsibility to the patient and the care team. Therefore, I think it's really critical for the clinicians to understand how the AI is actually helping them, why it was built, how does it actually work, can I actually vet it? For example, if it's pulling in prior information, can I at least go and check in the system that that information is correct? I think that building of trust is often underestimated in terms of how much that influences the ability to get these things adopted. So the trust factor and actually integration into the workflow is extremely important. When it doesn't work well, then we have examples where things just have not worked. And oftentimes one of the things that's referenced is a lot of alert fatigue. So AI is out there, it's looking at all of the information and it's sending up alerts. But if those alerts ultimately don't check out as being really meaningful alerts, then the whole system of alerts sort of kind of crumbles and doesn't get used. Well, I'm very encouraged and excited about some of the things that we're already seeing. So we mentioned the Nuance Dragon ambient experience. That's being used in clinical settings today, and it's actually capturing in an ambient environment the patient-physician discussion during a patient exam. And this allows the physicians to capture the full patient story as opposed to taking notes, turning their back on the patient. And the experience has really been amazing in terms of the type of feedback and the outcomes that we've got. It's really improved the patient outcome because the patient, I think, feels more listened to. We have tracked information around what the outcomes have been. So, for example, physicians who use it report a 70% reduction in feelings of burnout. They have 50% time savings when documenting care, and they actually on average save 7 minutes per encounter. But I think equally important is that very high percentage of patients, well over 80% of patients, actually say that the physicians are more personable and conversational during their visit. And the reason that this helps is that if the patient is feeling more trusted, more listened to, they can ask all their questions and get them all answered, it actually can reduce cost and improve the outcome for the patient, because if the patient doesn't feel like they were really listened to, they're much more apt to go get a second and third opinion that can delay actually the treatment for themselves. And it obviously also adds to the cost of care. I consider myself a lifelong learner, and I started out my career, I have a computer science background. I always have been intrigued by technology, but really for the purpose of actually being applied to something. So I look for candidates who have this similar drive of a lifelong learning. I also think having curiosity and being willing to kind of put yourself out there, come up with some crazy out of the box ideas, really push the norms that we become used to, bring in their experience, being willing to kind of push through and be resourceful, get with others and say, how does that inner drive, that curiosity, and probably most important, the ability to listen to customers and incorporate all of that. That I think is what really drives innovation. Customer validation and feedback, and really listening and seeing and observing how things are done today and questioning, like, why do you do that? What if we did it this way? That connection of your own curiosity and your own willingness to learn and your own willingness to put in that effort, but then actually do it with customers and really seek out customers, colleagues, peers, looking at the competition, looking at other markets that may be further ahead than healthcare.